As we've pushed medical innovation and capability to the leading edge of the battlefield, where we can save their life, we've got some guys that have some horrific injuries, and they're getting narcotics for a longer period of time. They certainly are at risk to develop dependency. And that's what we're trying to avoid. The Army Surgeon General directed that we establish the Pain Management Task Force to take a look at alternatives to narcotics.
There's very large randomized trials done at multiple centers that have demonstrated that acupuncture works. So we put together a study to see if we can actually insert this simple acupuncture technique during the aerovacs of wounded soldiers into Walter Reed and other medical centers in the United States. The question was, can we relieve their pain and reduce the amount of medications that they're on, so by the time they get back, they're not snowed under on multiple medications.
Guten Abend, welcome to Germany, and welcome home. I know you're heading home and you're excited.
What at first seems like strange bedfellows, healing-oriented mind-body practices and sort of the hardcore military, actually is an opportunity that they jumped at because of the pragmatic need and nature that the wars have driven them to respond to.
There's a very, very small chance that they have an infection or any of those kind of problems.
I am very skeptical about it. This idea that putting some little stick pins in your ear is going to cure pain on a 9-hour flight.
It wears on your lower back, wearing, you know, a 40-pound vest, and it's got to the point where the pain's radiating from my back down to my hips and then down into my thighs. And that's it. That's my nightly routine.
First one's going in.
How's your pain, sir?
I feel like I'm warming up a little bit. Pretty impressive, especially for it to react that quickly.
When you put the acupuncture needles in the ear, you see the activity drops down. So what has happened is you have reduced the signals or the processing of the pain.
When you provide a small stimulus like that, the body responds by trying to heal itself, trying to repair itself.
Right there. Okay. Go ahead and bend down.
That's pretty good.
Any pain?
Not when I'm doing that.
Normally you would?
Oh, yes. I haven't touched my toes in
Well, it
months.
means we're getting the needles in the right place.
Okay.
I haven't even gotten near my toes in months, unless I do this, you know?
How are you doing?
Oh, good. Yeah, actually, I want you there when I go into surgery.
Hi. How are you feeling?
I have pain, but it's more of an annoyance than it is pain. It's sore.
If you didn't have the acupuncture needles, how do you think you would be feeling now?
I'd be chomping narcotic.
Yeah. Oh, you would?
Oh, yeah.
Oh, so you haven't taken it
No.
because of that? That's good.
15 years ago, we did a consensus conference at the National Institutes of Health, and we asked the question, do we have good evidence to show that acupuncture is safe and effective for any condition? They said, absolutely, it's been demonstrated that acupuncture is safe and effective, especially with post-operative and injury pain.
Thank you. Appreciate it. Thank you very much. Good time.
15 years later, you can't walk into your average hospital today and get acupuncture after an operation. The problem is not that it doesn't work. The problem is that we haven't figured out how to get it into the system so that we can make it widely available to the population.